I'm Dr. Nancy Reau from Rush University Medical Center, and today I'm going to review some of the questions I frequently hear about hepatitis C. The first is simply, what is hepatitis C? And it's easy enough to say that hepatitis C is a virus that infects the liver. That liver infection isn't always a terrible thing, which means that some people who get infected with hepatitis C, which is transmitted through blood and body fluids, they don't always end up with a bad liver infection. Some people, when they first get an infection, will feel maybe a little bit like any other virus, achy, a little bit off, but most people don't realize that it's an infection of the liver. Because of that, we call hepatitis C the silent killer, because it's usually discovered only years and years later without proactive screening, when a person gets symptoms that are signs of significant liver injury. So hepatitis C is an infection that's passed through blood and body fluids. It's a virus, and that virus likes to infect the liver, causing liver damage, which usually takes years and years and years. The second question I hear is often, how is hepatitis C spread? So like I suggested, it is an infection that's transmitted through blood and body fluids, but our bodies are pretty resilient, which means that hepatitis C usually has to get around our body. And that makes injection drug use or needle stick injuries if you're a healthcare professional, or MSM, or men who have sex with men, so that the type of way of getting exposed to this infection is usually percutaneous, or punctured through your skin, and exposure then to someone else's blood or body fluids. When we think about this means that when we didn't really know what hepatitis C was, there were a lot of things that were iatrogenic that allowed hepatitis C to cause infection. Iatrogenic is when it happens kind of in the healthcare setting. And this is especially true about blood transfusions or organ donation, things that occurred before 1992, when we didn't really have excellent screening that allowed us to make sure that these products were safe. Now our blood products are incredibly safe. And so hepatitis C transmission through the healthcare setting is very quite rare. In addition to blood, you can imagine that other things that might have had exposure to someone else's blood or body fluid could also allow infection. This includes like vaccines or antibiotics, anything that might have had like a big shared source. So now everything is very personal, but a long time ago, a dose of a vaccine or a dose of an antibiotic might have been from a large, vial, and then you took that one dose out of that vial and gave it to someone. And so we do realize that iatrogenic or kind of sneaky spread of hepatitis C was very common. And this is why our birth cohort, or individuals born between 1945 and 1965, were targeted specifically for screening, because they were the ones that were at most risk to have been exposed through kind of one of those iatrogenic ways. We also know there is a very small chance of getting exposed through sharing personal items like razors, nail clippers, toothbrushes. This is certainly not the most common way, but if you live with someone who has hepatitis C, you want to be careful with those types of products. And then there is also a very small chance of getting exposed at the time of birth if you're born to a mother who has hepatitis C. So active infection of the mother at the time the baby is born allows about a 5 to 10% chance of getting exposed to hepatitis C. And so we do recommend screening all children born to hepatitis C positive mothers. Remember, that child could be 50 years old now, so that that risk doesn't go away just because you've managed to age gracefully. So another common question I hear is, how can hepatitis C be prevented? Or how can people around someone who has hepatitis C not get infected? So the first thing is that casual contact or everyday contact to someone with hepatitis C very, very rarely would lead to infection. So you should not be afraid of your relatives or your loved ones that have hepatitis C, because just living with them, using the same bathroom, using the same fork and knife, drinking out of the same cup, this does not allow hepatitis C spread. And so you want to really be supportive of those individuals who have hepatitis C, because sometimes they're scared and they really need their support network. So do not be afraid of them. Are individuals who engage in higher risk behaviors, so someone who has it has injection drug use, or might be, getting body piercing or tattooing, especially in a non-regulated setting. These things are a little bit higher risk. But remember, you can still manage to do high risk behaviors in a lower risk way. That means that if you are dependent on injection drugs, that you please use your needle exchange programs. Understand that there is a lot more than just the needle that can allow hepatitis C spread. So all of the paraphernalia or the other products that go along with injection drug use can also have someone else's, if they're exposed to someone else, can have hepatitis C risk of infection. We also know that that's true with inhaling. So don't share straws, don't share anything that might have come in contact with someone else's blood. And the same is true with body piercing or tattooing. Make sure that you do not share anyone else's needles or ink. Hepatitis C can be in the ink. And so, just be careful with anything that might allow or have been exposed to someone else's blood or body products. So one of my favorite questions is, what is the treatment for hepatitis C? So a while ago, hepatitis C treatment really had a lot of side effects. It was injection medication, and it didn't always work that well. But for the last decade, we have had incredibly easy to use all pill therapy. So the medications are given for between 8 weeks and 12 weeks for almost everybody. They have cure rates of nearly 100%. And although nothing is ever completely side effect free, a number of side effects that are possible with these medications is actually quite low. And I have, in my years and years and years of hepatitis C therapy, I have rarely had someone who felt that they needed to stop the medication because of side effects. That wasn't true at all with our previous therapy, but over the last decade with our all oral treatment, the medications are incredibly safe and very well tolerated. Now, even though something is safe and well tolerated and doesn't have a lot of side effects, you still need to be cognizant that they can lead to drug-drug interactions. So be careful of any other medication that you're taking. Make sure that if there's something new, or if you're taking a medication, that you talk to the person who's prescribing therapy for you to ensure that those medications can be combined safely. And although that we do have a couple of treatment options, and we usually interchange them equally, which means that either medication is generally a great idea for any patient. There are some exceptions to that. So if you have very advanced liver disease, sometimes the medications are not processed the same, and so you want to make sure that we're a little more careful. And then sometimes those drug-drug interactions can lead to one medication being preferred over the other, and that's why, again, you want to talk to your doctor about anything that you're taking. Another question I commonly hear is, should my family be tested? And so the answer to that is absolutely yes. We recommend a one-time test for anyone between the age of 17 and 79. So that's independent of whether or not you live with someone who has hepatitis C. So the CDC is very comprehensive in their screening recommendations for people who could potentially have been exposed to hepatitis C. Remember, it doesn't cause a lot of symptoms. People often don't know they have infection. And because of that, the CDC says essentially everyone should be tested at least once. Testing is also more frequently recommended if you have high risk factors. And so one-time test is not adequate if you're injecting drugs, or you are a man who has sex with another man, and your partner has hepatitis C. These are all cases where ongoing serial screening is recommended. Now, if you live with someone, or if you have a family member who has hepatitis C, it's always a good idea to be tested at least once, but you don't need to have recurrent testing. Anyone who has, sex with someone who has hepatitis C should at least be tested. But sexual transmission outside of MSM is a very uncommon reason to get exposed to hepatitis C. And like we talked about earlier, if you were born to someone who has hepatitis C, so if your mother had hepatitis C, that child should be tested. And child is a very blanket term, so that if your mother if you find out that your 80-year-old mother has discovered that I have hepatitis C, that 80-year-old should have all of her children tested, unless you're absolutely certain she was exposed to hepatitis C after all of her children were born. This is obviously going to be more relevant if you're screened during your pregnancy and you're found to have hepatitis C. That is now universally recommended by the CDC, by our liver societies, and our maternal fetal medicine societies. And that child then should be tested after birth. There's a little bit of wiggle room as to when that child should be tested, sometimes in the first year, but definitely by the age of 3, the child should be tested for hepatitis C exposure. And usually that's around a time of, where we could consider therapy at the first time. So screening recommendations for children are a little bit gray. Testing can be recommended as early as in that first year, but absolutely by the age of 3, testing is universally recommended. So another question I often hear is really centered on how many touch points do I need during therapy? And this is relevant because a lot of our patients don't live next to the hospital. It's inconvenient, they're working or they're physically very distant from the location. And so how often do I need to see you during treatment? Now, every patient-physician relationship is unique. And so your doctor might think that you need to be seen more frequently, but most of my patients are able to actually start their therapy over the phone, or we mail the treatment to the patient. Your specialty pharmacy would mail the medications or arrange a convenient place for them to be picked up. And then we talk about how to take the medication over the phone. And then I usually will touch base somewhere in that first month to make sure the treatment is going well. And then we will often see the person sometime in the middle of therapy if they want to be seen, but sometimes I really don't see my patients at all. We kind of manage things over the phone or through telehealth visits, and then reassure them that they've been cured by testing for the hepatitis C viral level. I do that 1 month after treatment has been completed, and then again around 3 to 6 months to ensure that they're truly cured of the virus. And that is pretty easy. Now, in my patients who have more advanced disease or have cirrhosis, we know that they need to have ongoing longitudinal care. What does that mean? That means that curing your hepatitis C is absolutely the best way of lowering the chance that you're going to have complications of hepatitis C, such as developing a liver cancer, having your cirrhosis get worse, needing a liver transplant, but it does not eliminate all risk. And so all of my patients with hepatitis C related cirrhosis or cirrhosis from any cause really need to be followed serially. If you are very healthy but have cirrhosis, I normally see my patients twice a year, and that would definitely include after we've assured that you're cured from your hepatitis C. And if you have any symptoms of liver disease, so your liver disease is more advanced, this is someone that I'm going to see during treatment and more frequently after treatment. Even in these individuals who have more advanced disease, their liver typically will get healthier as time goes on after they've been cured. But that risk is a little bit higher. And so we really want to make sure that you're doing well during treatment. The other time that I might see a patient more frequently is if they're on drugs that might have interactions, so that I ensure that they aren't having side effects or that they're doing well from that standpoint. Or if there's something else going on, like my patients are struggling with depression or they're having side effects that might be related to the medication, then I'm certainly going to want to see you. And those can sometimes still be telehealth appointments. But if you're really struggling, then we're going to want to see you in person, because that's the best way of making sure that we can understand exactly what's going on. Another frequently asked question is, how do I stay healthy? So I get a lot of questions about what's the best food to eat with hepatitis C, or what else can I do to protect my liver? So there is no universal hepatitis C diet, but most of our patients with liver disease, we talk about a liver healthy diet, which means it's lower carbohydrate, higher in proteins that are not saturated fats, kind of like the diet that you would imagine is healthy for most of your ongoing health. Now, if you have specific problems like kidney disease or heart disease, or diabetes, then you're going to follow the diet that's specific for those health problems. But from a hepatitis C or cirrhosis or liver standpoint, we really are concentrating on that higher proteins, less simple sugars, kind of that Mediterranean-like diet. Now, the Mediterranean diet does allow a little bit of alcohol, and we definitely understand that alcohol use with hepatitis C is much more dangerous. And so I do encourage all of my patients to be abstinent once your hepatitis C is cured. Certainly, if you do not have significant liver disease, resuming what the CDC would consider healthy drinking is probably very reasonable. The CDC would say no more than 14 alcoholic beverages in a man and 10 in a woman per week. So that's 1 to 2 alcoholic beverages, not every day. And we try to avoid daily drinking. It's also really important to not smoke. This is kind of a tried and true message for a lot of things, but smoking does increase the risk of liver cancer, as well as other types of cancer, including lung cancer. And so we recommend that smoking cessation is universal for all of our patients. You also want to be really careful, again, if you have high risk behaviors for getting re-exposed to hepatitis C, such as injection drug use or close interactions with a hepatitis C positive partner. And then we're always careful with medications. So, always talk to your doctor about any medication that you want to start or take, and that does include supplements, over-the-counter products, herbal medications. You want to make sure that those things are safe for your liver. And especially if you're on hepatitis C therapy, those things need to be very closely discussed, because even if a product is quote unquote all natural, that doesn't mean that it's not metabolized by the liver, and that could still have interactions with your hepatitis C therapy or other medications. Thank you again. I hope that we addressed most of the questions that are concerning to you. Hepatitis C is a frightening label, can lead to very significant liver disease, but if found early or even if found late, curing hepatitis C really does help keep the liver healthy and decreases the risk of complications like cirrhosis and liver cancer.